Welcome to the Putnam County Library Lunch and Learn. Today we're joined by Sandra Miller, who will be discussing the Dementia Navigator program. Take it away, Sandra.
Thank you. Like you said, I'm Sandra Miller, covering for Tracy here today. And we have the Dementia Navigator program in Putnam County. We have it in several other counties. I actually work in Scott and Morgan. It's also in Rome, and it's in Bradley, Hardeman as well. And that covers it: Scott, Morgan, Rome, Putnam, Bradley, and Hardeman County at this time. But we're hoping eventually it will go statewide, and it's through the health department. So hopefully we can get it to go statewide in every county. I'm going to talk a little bit about brain health, healthy living for your brain and body. What is brain health? It refers to how well a person's brain functions across several areas, which is motor function, which is controlling your movements and balance; sensory function, seeing, hearing, tasting, and smelling; tactile function, feeling and responding to sensations of touch, including pressure, pain, and temperature; cognitive health, thinking, learning, and remembering; and emotional function, interrupting and responding to emotions, interrupting. And the brain is a control center of the body. Over 100 billion nerve cells or neurons create a branching network. Signals traveling through the brains form memories, thoughts, and feelings. Alzheimer's disease destroys brain cells. Your brain is 2% body weight, 20% of energy use, small but mighty powerhouse. The heart-brain connection. The heart and brain are interrelated. What you do to protect your heart can also help your brain continue to operate at its best. The brain needs blood flow. The brain depends on oxygen and adequate blood flow to work well. It receives 20 to 25% of blood from every heartbeat. Dementia is a syndrome. Dementia is the umbrella term, like cancer is the umbrella term for all types of cancer. And so Alzheimer's, there's 60 to 80% with Alzheimer's. Vascular is 10% to 40%. Lewy bodies 10% to 25%. Frontotemporal is approximately 10%. And dementia is a collection of symptoms related to cognitive decline. Can include cognitive, behavioral, and psychological symptoms due to biological changes in the brain. Alzheimer's is the most common cause. Mixed dementia is very prevalent, where you have more than one type. Some causes of cognitive decline are reversible and not truly dementia. And hallmarks of Alzheimer's disease is extracellular deposits of beta amyloid and intracellular deposits of hyperphosphorylated tau. And I don't know if you can see this, if they would be able to see this in any way, but this is the part of the brain where it's shrunk, where it has the disease. And this one's the normal brain over there. Question is Alzheimer's a normal part of aging? People say you forget when you get older. There are some things that I'll talk about different, but it's not. Alzheimer's is a normal part of aging. It was false. Alzheimer's is a progressive and fatal brain disease. Symptoms usually develop slowly and get worse over time. It is not a normal part of aging. Normal aging: making a bad decision once in a while, missing a monthly payment, forgetting which day it is and remembering later, sometimes forgetting which word to use, losing things from time to time. Alzheimer's disease is making poor judgments and decisions a lot of the time. Problems taking care of monthly bills, losing track of the date or time of the year, trouble having a conversation, misplacing things often and being unable to find them. Dementia is a general term. We went over that as the main umbrella that everything's under. Some healthy behaviors may lower the risk of dementia. The biggest risk factor for dementia is age, environmental, vascular disease, genetic, head trauma, family history. Advancing age is the #1 risk factor for developing dementia. After the age of 65, risk doubles every 5 years. After age 85, risk is 1/3. Women have twice the risk factor than men of developing Alzheimer's. Ethnicity, Black persons are 2 times more likely, and Hispanics are 1.5 times more likely. Genetics, there is some evidence that genes are a factor. No specific gene has been identified for older onset Alzheimer's. If a mother or grandmother had dementia, risk factor, it's significantly greater. But it doesn't always have to be older people, because I had run across a news article that like a small child had a type of dementia. I mean, it was, and my supervisor didn't even know that either, that existed. So modifiable risk factors that you can change, they can be lowered risk up to 40% by making lifestyle improvements. Physical inactivity, try to be more active. Obesity, work on your diet. Tobacco use, substance abuse, diabetes, midlife hypertension, social isolation, low educational attainment, cognitive inactivity, midlife depression. Things that you can change. Sleep is a big thing. You need to have normal, try to have a normal sleeping pattern, like get 7-8 hours a night, or day if you work nights, try to make sure you have the appropriate amount of sleep. Smoking, work on stopping that. Mental health, be physical, balanced nutrition, engage cognitively, like if you play games, do word puzzles, something like that, and social engagement. Healthy habits may be beneficial for your body and brain. Also, work blood pressure, ask your healthcare provider what the numbers should be. So blood pressure, blood sugar, your weight, cholesterol. Science tells us that there's many factors that increase the risk of heart disease and stroke, may also increase the risk of cognitive decline and dementia, hypertension, diabetes, and midlife obesity. Good cholesterol is good for the heart, and what's good for the heart is good for the brain. Research shows that type 2 diabetes increases a person's risk for developing dementia. Risk also increases with the length of time someone has diabetes and how severe it is. Diabetes is linked to other dementia risk factors such as hypertension, high cholesterol, and obesity. Some of the changes that occur in Alzheimer's disease are similar to those in diabetes. In both nerve cells in the brain may become resistant to the effect of insulin. This may lead to the buildup of amyloid and tau proteins in the brain. Alzheimer's disease is sometimes unofficially known as type 3 diabetes. Insulin insensitivity has been linked to memory deficits, cognitive decline, and many characteristic symptoms that have been displayed in Alzheimer's disease. Obesity between the ages of 35 and 65 can increase dementia risk in later life by about 30%. Obesity is also linked to other dementia risk factors. People with obesity are 2 or 3 times more likely to have high blood pressure and type 2 diabetes. Obesity can also lead to chronic inflammation in the body, which can affect the brain. Inflammation in the brain is linked to dementia, as it can cause overactivation of immune cells in the brain, which leads them to damage the brain's nerve cells. And people of all ages can benefit from being more physically active. I'm gonna switch over to some more information. This information here that I have, attended a program where some of the staff from the Pat Summit Clinic presented, and one of them was a cognitive neurologist. And some of the things that she said was very interesting. So I was gonna kind of go over, we were able to get a copy of the slides. And it's like what's normal, and I'll say what's normal and what's not normal, but talked about memory may take a little longer to learn, may take a little longer to recall information, may forget a name or place, but recall later. Now that's attention. That's like where you don't have it, it's just, everybody can do that. Executive function, processing speed reduces, takes a little longer, a little more cautious and risk adverse. Occasionally make a mistake with finance or bills. And then she put a little thing that says, I'm trying to remember what I ate for dinner, but it's on the tip of my tongue. And it's a picture of a frog trying to, where you try to come up and think of something. And visual, spatial, finding your way to new and old places, searching for things that are right in front of you, knowing where your body is in space, giving and following directions. Social cognition, interactions with others, moral compass, controlling impulses, biting your tongue, being a good citizen. And then abnormal brain aging. I don't know if y'all are aware, there's like mini cogs that can be done where, and some of you may have had these before. You go to your doctor and they give you 3 words to remember, and then want you to draw a picture, and then go back and get the three words again, get those from you, or having you to draw something, draw the clock too, to show that you can keep your numbers and keep everything aligned where it should be. Defining cognitive changes of aging, subjective cognitive concerns, mild cognitive impairment, and dementia. Mild cognitive impairment is self or informant report of decline from individuals' pre-morbid baseline, objective evidence of decline on cognitive testing, absence of significant impairment of instrumental activities of daily living, approximately 10 to 15% per year progress to dementia. Mild cognitive causes: not getting enough sleep, taking care of your brain, medications, and really taking care of your brain, protecting it. Like I talk to kids about sports and things like that. Football players have helmets, and we were talking about cheerleaders. They have, when they're up on the pyramid, fall off, and I was talking to some children about that, and the adult that was in the class said, that happened to me. I was on top and fell and I've hit my head, pretty hard on the floor. So, that gives her something to be concerned about now. Like dementia definition, acquired and persistent change from baseline functioning for that purpose affects at least 2 cognitive functions, severe enough to impact daily functions. And I gave you the dementia, the different types of dementia. Symptoms and signs of dementia, the lost and found, the missing bills, and just can be, your behavior can change too and be someone you might not used to be. Can get physical and get angry easy, and it's according to what type of dementia you have. But some of those are more prevalent in certain types. So, big thing, look after your heart, be physically active, follow your healthy diet, enjoy social activity, challenge your brain. And then, same thing, in this, I think she really wanted to get it through to us, like how to reduce the dementia risk. Let's, like say, protect your brain, education, be active, and spend time with other people. Don't shut yourself in. And hearing, can also affect dementia too. You can have a hearing aid, that as long as you can hear, but it can also affect dementia. And the summary here on what she had here was cognitive does change as we age. Cognition does change as we age. Cognitive continuum ranges from normal to mild cognitive to dementia. We all can do things to reduce our risk of developing dementia. So that was that program. I think I've shared. I think I'm good.
Yeah. Thanks, Sandra.